So to introduce the first of the three speakers who will each speak for 15 minutes, we have Anna Garrity. Anna is currently head veterinary nurse at Medivet in Orrell Park. She studied at Myers School of Veterinary Nursing and qualified in 2017 with an FDSC veterinary nursing and proceeded to top up to her Bachelor of Science honours. She has held the position of Wellbeing Champion since 2019 and has a strong passion for this area since her dissertation research. She is planning on carrying out further study for her master's degree and aims to further improve wellbeing and mental health within the veterinary sector. So Anna, welcome, and I'll hand over to you for your talk on do registered veterinary nurses feel stigmatised by acknowledging stress and accessing support? Over to you, Anna.
Hello everybody, it's so nice to be part of this. Today's been super interesting. I've learned a lot of information as well, being from small practice, for example, about farm vets and sort of issues and hardships they're facing. So I feel like this is really interesting for us all to be a big part of. I know that we're pressed for time, so I'm going to sort of dive right in. My slides are pretty, there's not too much on them, there's not too many photos and there's not too much writing. I sort of wanted to talk around the topic with yourselves. A lot of us have landed sort of within a quick keen interest in mental health from different areas and backgrounds. I wrote this piece of research as part of my dissertation, and I wanted to look at behaviours within practice and how we can benefit. It was from a BSc Honours and it was completed a couple of years ago now. I do have a keen interest in mental health, and both of my parents are nurses, and this is where they sort of stem from. My mother is a registered general nurse in human nursing, and now she works for a branch of the government, still using a nursing. And my father was a registered mental health nurse who is now a psychotherapist. Both, coincidentally, and also part of why I was interested in this research, have struggled with mental health at different points due to work-related stress, and both had to take long periods of time off work, access external help, part of why my dad became a psychotherapist. So looking at the sort of hardships that they'd faced made me interested to see what can we take from our human counterparts, what can we do to benefit us within the veterinary industry. Listening to their perceptions and experiences made me query further how we feel within us, and how we can support the importance of the RVN community. When I was 23, I wrote this, so as I said, it was a couple of years ago, and it was in 2018. It's a couple of years old now, and I'm sure there's lots of changes in figures, especially post the pandemic. So I would be interested to see how these things have changed and what we can do now to look again. A lot of the research, when I completed this, is taken from our human counterparts. There is scant information, research papers around RVNs, so I did find it a real struggle when I was completing this. I looked at my slides again this morning just to ensure I was happy with everything, and I just want to apologise because couple of spelling mistakes on there. I did complete it on my mobile phone because I've been having a couple of technical difficulties. So once again, I just want to apologise for that. Can we go over to the next slide, please, for introduction? Lovely. So there are ever-increasing demands and pressures placed on us within the RVN setting, as I know that you're all very aware. And it's self-evident that the mounting pressure within practice brings a significant amount of increased stress, pressure, and in turn illness. Staff morale and job satisfaction is super important and needs to be examined closely by our employers to maintain and develop RVNs further. I'm really sorry, my cat has just turned up at the most inappropriate moment. As a team, looking together to work as a team. The provision of relevant and useful support services for staff members needs to be maintained, and ensuring that we can always look to go somewhere. Great today further mention our vet line and external help that we can contact should we need to. Consciousness of stress related to the RVN culture needs to be looked at further. And as I said, looking at this research again, when I completed it, really struggled to find anything about us. Can we go to the next slide, please? So the rationale sort of around this and why, as mentioned previously, we know the level of stress and mental health issues in the veterinary sector has become more well documented. Today is a great display of this. As Rory mentioned earlier, unfortunately, our veterinary surgeons are 3 to 4 times more likely to take their lives than the general public. Not only is this a saddening statistic, and it only begins to show the stresses and hardships of the veterinary community face, but us as RVNs, we work alongside that. Rory also talked about how many people it affects, and especially us closest to them, what could we do better, etc., etc. As other RVNs are also becoming more autonomous each day, and the RVN profession grows, it's becoming more increasingly stressful, and members of the community struggle to access help, causing potential stigmatisation. Stigma can connect individuals together with a negative characteristic. This is not due to a stigmatized condition, but it's how our culture reacts to it. RVNs have the potential to feel stigmatized within the industry as it exists towards nurses with mental health difficulties, nurses that have mental health difficulties. That piece of information was taken from some research that was done around RGNs when I was completing my dissertation. As we know, it is recognised that burnout can be caused due to stress and has the potential to cause life-limiting effects, not only within the RVN community for one another, but also within the profession and also our personal lives. The issue of work-related stress has become ever more present in the modern day workplace, and it's become far more apparent that the occupations can succumb to negative effects of work-related stress, but higher numbers within the healthcare industry which is where we really need to home on. As Mind Matters initiative has noted, dentists, doctors, vets really looking into that as well. Within the healthcare, it seems that RGNs have been stigmatised for accessing help themselves, registered general nurses from the human side, and whereas they would recommend help to their patients in the same ways that we as RVNs may struggle to discuss what goes on within our job role to our partners, our colleagues, and we would suggest that other people may access help, but we could potentially we may recommend other people access help, such as potentially colleagues, but also clients. But seemingly within nursing, there is a tendency to adopt to do as I say, not as I do philosophy. And there could be a stereotype and a cultural fantasy that nurses should always be able to cope with stress. Conclusions that were found were quite concerning within the cultural aspects of nursing, such as organisational demands, expectations socially, and the benefits of the collective. The points mentioned could potentially as well become stress inducers. Nurses could have access to support, education, and awareness for the RVN community. The absence and attention of this could further lead RVNs feeling work-related stress, depression, and anxiety. Could you switch slides for me, please? The aims of the research was an attempt to establish an overview of RVN's attitude towards seeking help and the provision within our workplace. As nursing encompasses such a broad range of specialities and variations of employers, first opinion, referral, voluntary, farming, as we discussed, I believe it more pertinent to provide a quantitative method of approach. This was chosen to provide effective and useful data on the topic, as it made it quite a little bit easier to collate the data from the questionnaire across the identified RVN group to try and maximise the potential. The questionnaire was designed to be accessed from an RVN social media platform. If you could switch the slide for me as well, please. Thank you so much. The nature of the research being undertaken, as we said, seeking information in relation to RVN's attitude. I chose the format, was a questionnaire, as I mentioned, done through SurveyMonkey, and it was indicated by previous research and things that I'd read that this was the best sort of way to go about it, and a quantitative and qualitative paradigms were used within the study overall. The qualitative data used questions gathering information based on opinions, perceptions, and feelings of RVNs. And as I previously mentioned as well about multi-paradigms, which when I've read around the subject, could improve the research, generating more comprehensive insight and give results from a different perspective. Using the triangulation method helps to increase reliability as well as validity with the study and assist in overcoming bias. The research is aimed for perceptions of our RVNs and how they feel stigmatisation, accessing help and work-related stress. Due to the qualitative and quantitative research methods were used to produce the data. And if you could switch the slide for me, please. So I've just put on the slides a couple of questions. I did quite a few. I'm just going to show you what I've sort of done and then have a chat just around it. So the questions that I put out, quantitative and qualitative, as I said, I had 138 respondents, and the study was live from 1 month between December 18 to January 19. As said previously, social media platform was used, and the first question is, do you feel that your workplace was a stressful one? Now, it was found that near 60% of RVNs agreed that their workplace is stressful, as I'm sure we're all aware, and close to 29% strongly agreed. This information shows that close to 90% of the RVNs felt that their workplace was a stressful one overall, which I'm sure doesn't come to a shock to you guys, but then it's making decisions on how are we going to combat the stress or how we're going to alleviate it in different ways. Next, please. Nurses should be able to cope with work-related stress at all times. Work-related stress and burnout go hand in hand. Over 50% of the RVNs who completed the survey feel that nurses should not just need to cope with stress. And then if we can go to the next one. Thank you. This is my favourite question. Are you happy in your workplace? Although a very generalised question, it's a nice question to know. Are we happy? Are we okay? And it seems the perception is that, yeah, we are pretty happy. It was a positive outlook, and around about close to 50% of nurses agree, and a further almost 16% strongly agreed, leaving less than half the respondents in an unhappy workplace. A couple of the questions I did ask was, your colleagues would think less of you if you access support as a result of work-related stress, and only 20% agreed or strongly agreed, and 60% disagree, which I feel is overall pretty great. In general terms, it seems we're pretty happy with in practice, although where it's stressful, we feel that our colleagues wouldn't stigmatise us if we access help. Workplace support is readily available to us, was a question further posed, and it seems that, yeah, it is. Almost 35% of us agreed that our workplace can provide us with support. Lots of other people didn't give a response particularly, so I'm unsure, but I think that means that we're moving somewhere within the community. And if you can go to the next slide, please. I think I might have missed one there, but it's okay. It was just the limitations around the research. The sample size was definitely a limitation. And back in 2016, the RCVS published that there were 13,500 practicing RVNs. This study was only 138 people. It's around about 1% of the RVN population. It doesn't consider those registered out of practice or also practicing abroad. And overall, realistically, is a poor sample size and only provides us with a small amount of evidence to support the null hypothesis, but leaves a need for more evidence to be found. Further research is definitely required in this field to gain a larger sample group and more reliable evidence. Further to that, the evidence and the conclusion show that RVNs are in fact happy in the workplace, as I said, which I'm glad to hear. And whereas almost 27% agreed that management was sympathetic and understanding to the needs. And if you could switch the slide again. The principal idea overall of the study design was to view RVN's attitudes, beliefs and potential behaviours. I used a 5-point Likert type scale that was used to utilise the data collected with relevant aims and objectives. And then switch the slide again. Sorry, I'm aware there's only limited time. Due to the questionnaire being originally designed, obviously produced by myself, written by myself, it was important that the construction was completed with care to ensure objectivity was upheld and that the closed and open questions would not have bias in favour of my expectations. Many draft questionnaires prepared, changed and developed, and then it was sent to the ethics committee for evaluation. As an RVN, I have absolute awareness on how support can be sought within our workplace by one another, where we can seek it. But it's finding out if other people are also aware of this. The research was completed in hope to highlight the RVNs feel it an element of stigmatisation within the industry attached to seeking help due to their mental health. I just wanted to understand the RVN's conclusions and outcomes of their experiences were. Further factors that I feel it may be involved may include a lack of trust in the workplace to reach out to our management. So it's really working to build a happy, safe place to talk to one another. And is it a structure of internal mechanisms and clinical supervision that aren't allowing us to talk? But as I said, this piece of research seems to be quite favourable for us. So overall, as I said, the sample size wasn't great, but we seem pretty happy, but I would be keen to see how things have changed. Sorry if I just rushed that a little bit towards the end, but I think that's it. That's everything from me. The last slide is just references from people that I took the information from. I've covered all that now. I think I've circled back. Thank you so much for listening. I really appreciate your time.
Fabulous. Thank you very much, Anna. I think your enthusiasm and your passion come across really, really strongly. So thank you.